Well, good afternoon. Thanks once again for joining us for this daily update. I'm Dougal Saunders. I'm joined today by Assistant Commissioner Jeff McKechnie, Commander of the Western Region for the New South Wales Police Force. And back with us today is Dr Jan Fazell, who's a Senior Medical Advisor with the Public Health Team. And we'll talk a bit about testing rates, but also some of our contact tracing again, just to provide a bit more detail about how all of that is working. Up until 8 o'clock last night, 27 new cases in the Western New South Wales Local Health District. Dubbo has 17 of those. Bourke LGA has 6. 3 of those are at Ingonia. Bathurst LGA 3, Walgett Local Government Area 1, and the Far West has 7 new cases, all located at Wilcannia. So the health district total now 885, Dubbo 653 as a total figure. I can tell you that 488 people are currently in the COVID care in the community program, and 48 extra people have now exited from that program. So that means they're no longer infectious, no longer requiring any care, and that total now is over 390 people that have come out of the community care program, which is great. Sadly today, I can confirm that we have another death, a man in his 60s, from the Dubbo region who passed away at the Royal Prince Alfred Hospital in Sydney. The man was Aboriginal, he was unvaccinated and had a number of underlying health conditions. Our thoughts obviously are with the man's family and friends and entire community at this extremely difficult time. And of course this is never an easy thing to talk about, to mention, but it is one of the stark realities around COVID-19. This is now the 3rd death that we've recorded in the Western New South Wales Local Health District, and our thoughts are with all those family and the wider community at a difficult time like this. Out of respect, we won't be providing any more detail at this point in time. From the 27 new cases that we have up until 8 o'clock, at least 8 we're aware of being infectious in the community. 13 have been isolating, and 6 are still being investigated. The links we have, 12 are household contacts, 5 are linked to cases or clusters, and there are 10 of those that are still being investigated as well. Looking at hospitals, total numbers in hospitals up to 24 now. Dubbo's got 17 of those. There are 5 patients in ICU, 3 of those are currently being ventilated. No new sewage detection where there are no confirmed cases. There was positive sewage detected at both Bourke and also at Mudgee as part of regular surveillance testing, but really no surprises there. Both of those have positive cases. So overall demographics I thought was worth sharing today. We know that 63% of current positive cases are Indigenous, 47% are in the age group under 20, 85% under 50, and 3% now over 70, which doesn't sound a lot, but that 3% is 31 different people. Talking of that, our aged care facilities, just to update you on St Mary's Villa first of all, no additional cases identified there, so 7 in total, 5 residents, 1 staff member and 1 visitor. And at Holy Spirit in Dubbo, again, no additional cases have been identified, 8 in total there, 6 are residents and 2 are staff. And look, every day the outbreak management team is meeting and looking at all of the scenarios. Residents are being cared for and managed with their symptoms on site. Testing, just over 2,800 for the entire district yesterday, which again is a drop back to sort of unacceptable levels really. We do need to keep asking you to come forward, and Dr Jan will talk a bit more about the importance of testing in our overall approach to controlling and having a pathway out with COVID-19. So again, even the mildest symptoms or any concerns about where you may have been or somebody that you've been in contact with may have been, we really want you to come forward for testing. We also do want you to keep a view regularly on the venues of concern, which are updated on the New South Wales Health website regularly and through all of our Facebook pages as well. So do keep an eye on that, like at least once a day, maybe twice a day if you can, and let the people in your life that maybe don't have access to internet or Facebook pages, let them know what's happening as well. Please, we need you to be part of this. Dr Jan will talk more about that and also just around some of the tracing that goes on and practically how that actually works. Just on testing facilities, most of them still open. There has been a change at Mudgee. The drive-through has now finished there, so any testing at Mudgee is happening at the hospital. You will need a booking for that. And just to let you know, drive-through testing clinic now happening at Walgett Swimming Pool. That started today, running through until Friday. It may go further if it's needed. That's through 9:30 till 4 p.m. No bookings needed, of course. Just turn up for Walgett, and the mobile at-home testing, which we heard again from Brendan about yesterday, which is working really well in some of our larger centres like Dubbo, Bathurst and Orange, but also available in other parts of the region. 1300 066 055. That's the main public health line for any help you need with any of those health types of scenarios. Now, vaccination is... Sorry? Right. Vaccination, look, just a really important note around the vaccination which is happening around the region, and this is good news. Nearly 2,500 doses of vaccines going into arms, so that's incredibly good news. So congratulations on everyone that's lining up and getting a jab. We know the ADF teams are today at Orange, Bathurst, Walgett, Cobar and at Coolah. Also, your vaccinations are available at all the other spots we keep talking about, the GPs, the pharmacies, your local Aboriginal medical service, the respiratory clinics. The ADF clinics are not the be-all and end-all. They're part of doing a big bulk at one time, but there is so much more availability through all of our other services like GP clinics and pharmacies. So please look at that. Please keep looking for those options as well. And AstraZeneca, if you are turning up to one of these pop-up clinics and say you're at Bathurst or Orange today, if you put your hand up for the AstraZeneca, you are more likely to go straight to the front of the queue. We've seen it right around the region. Those that are able to get AstraZeneca get it done far more quickly than if you're lining up specifically for the brand Pfizer. So think about that. It'll make sure you get it done far more quickly, and it's a fantastic vaccine which we're encouraging people to take up. Do remember, if you're going to a pop-up clinic, your Medicare card if you have one, your individual health identification number and or some form of identification, preferably a few different forms of identification with you as well. All of those walk-in clinics you don't need a booking for, but you will need maybe some patience and a bit of preparation. Think about the weather, hat, sunscreen, maybe a jacket, maybe some water, that sort of stuff. Now, the Dubbo Adf Clinic, which is coming back to the region now for second doses. So it will be here. It's actually been brought forward. So there's been a few changes for what I was probably saying last week. So we know now that the clinic will operate at the Dubbo Regional Theatre and Convention Centre, and it will be here now from Saturday. So originally that was to be at Pioneer Park and starting from Monday. To clarify that now for you, and we'll make sure all of this information is again in this post. The clinic, second dose Pfizer, will be at the Dubbo Regional Theatre and Convention Centre and starting on Saturday. There's lots of moving parts in any operation like this, so things have changed a bit over the past few days. So clarification for you today. Around that, if you had your first Pfizer dose at the Dubbo pop-up clinic last time, you will receive a text message. You'll be told when you can turn up at the Regional Theatre and Convention Centre for your second dose. So you'll be given a day and a time frame. So that will definitely happen. Now, if you didn't register with a phone or you didn't have a phone available, you can turn up to the clinic for your second dose. But this is a second dose clinic, and this is for Pfizer. Now, if you received your AstraZeneca shot at the pop-up clinic at Dubbo last time, you will get a text message in around a week or so. This is for Pfizer specifically because we're doing it in the 3-week time frame for second doses. AstraZeneca has a 4 to 6 week early dose. So the AstraZeneca, you'll receive a text message, and that will be at your nearest vaccination hub. So for example, in Dubbo, that will be at the Woolpack Pavilion, the main Vax hub that is operating here, and you'll be given again a date and a time to turn up to that particular vaccination hub for your AstraZeneca. So all of this will be relayed to you. Don't worry too much about it at the moment. Over coming days, you'll be receiving a text if you got your first dose at one of the ADF clinics. So that's the good news. And that will then continue around the rest of the region with second doses at all of the other locations. The ADF clinics were occurring for first doses as well. Just want to clarify as well, there's been a little bit of, concern around sometimes people not having Medicare cards, receiving then all of the identifiers needed to recognise you've had a first dose. All of that is being worked on in the background. In some cases, there has been just a miscommunication, sometimes the wrong person on the Medicare card, the name wrong, the number slightly wrong, all of that sort of stuff. So don't worry if you're worried that you haven't been recognised as receiving a first dose. If you don't get that text, we still want you to come and get that second dose. Bring all your identification and we'll make sure that happens. Other ways, of course, are still to keep booking your vaccinations, as we've talked about, through Health Direct. You can do that through the eligibility checker. Plenty of ways to keep getting vaccinations. Wellington still accepting walk-ins for this week. This is the final week at Wellington for first Pfizer doses. AstraZeneca is still happening through WAX and Swift Street Medical as well. But if you're wanting to get Pfizer at Wellington, 2820 postcode, this week is the final week of first doses. So encouraging everyone in that Wellington district to come forward if you haven't. They've only done about 244 doses over the past couple of days. So plenty of availability, plenty of possibility of getting that vax in Wellington. So encouraging you to do that as much as possible. I've mentioned before the Mudgee Vaccination Clinic is running a school vaccination program on September 18 and 19. So that's for children 12 and above. That will happen on that weekend, 6362 4031 for the Mudgee Vax Clinic to get more details and actually book in for that one. Before I hand over to Dr. Jan and then to Jeff, we have had a few questions and I thought I'd just answer that briefly today around Dr. Chant and the Premier referring to Dubbo as an area of concern. Now, people are worried that that means we are in a hotspot zone. At the moment, that is not the case. They have been referring to Dubbo as being a bit of a worry. Let's be frank, with numbers the way we've seen them, that is what they're talking about. So we are not officially recognised as an area of concern, as in a suburb of concern or a suburb that is a hotspot. We are a concern though because we have a lot of cases, so there is a lot of focus happening here, but not officially as a hotspot at this particular point in time. The other question is around lockdown or coming out of stay-at-home orders. There is expected to be an announcement tomorrow, that's Thursday, by the Premier and the Deputy Premier around different parts of New South Wales. Now the Dubbo region and our region more broadly is highly unlikely to come out of stay-at-home orders. We've got another 27 positive cases today. It is highly unlikely that anywhere in our region will be coming out of stay-at-home orders. I can't make it any clearer than that. The Deputy Premier has been very clear on that for a few days now. When we have cases like we're seeing, it is not going to work at this particular point in time, but others will have that opportunity. Right, I'll ask Dr. Jan to come forward now and talk a little bit about testing and tracing, and then Assistant Commissioner McKechnie.
Good morning. First of all, I'd like to thank all those people who have come out for testing. Testing is the only way that we can identify a case of COVID-19 and then work to make sure that any people that may have been put at risk by that person having COVID-19 can be appropriately contact traced and isolated. While we had 2,800 tests yesterday, there were nearly 1,200 of those tests in Dubbo alone. This is a really big region and we do need people testing. Don't think we never have a case here. Don't think I haven't been out. Please, if you have any symptoms, that could be a snuffly nose, that could be a sore or scratchy throat, that could be having a headache and feeling very fatigued. Please come forward and get tested. It is so important. I know it's spring and allergies are about. Don't write it off as allergies. Get a COVID test. That's the only way you know that that runny nose and scratchy throat is not COVID and could be your allergies. It's also really important to understand how important it is for those tests to result in our contact tracing. When people put off getting tested by a few days, that sets us back up to 6, 7, 8 days sometimes before we can actually tell other people that they may have accidentally put at risk that they had a problem. So if somebody has symptoms, they go to the shops, then they think, oh, maybe I'll get a COVID test, and then they go home, but they don't stay isolated while waiting for that result because they feel a bit better. 3 days later, when we get that positive result back from wherever it's gone to in New South Wales, and some people are getting those results back within a matter of hours, so that's really good news. The testing times are coming down. It's really important, though, that that can actually lead to a significant delay in alerting other people who may be at risk. And those people may have been to the shops, may have been to work, and they've gone home to their families, and now their families are at risk. So it can take us a number of days when people either don't get tested quickly when they've got those symptoms, when people who are informed that they're a casual contact don't take up that testing advice and only get tested later when they've got symptoms, and sometimes also just when people just ignore their symptoms altogether and only get tested when they get identified as a close contact. And sometimes they're the person who actually started that other person's infection. So it's really important that if you've got any symptoms whatsoever, you do, first of all, get tested. After it, isolate. That means in your own room. You're not sharing a room with anybody else. You're away from the rest of your family as best you can be. If you share a bathroom, make sure you clean it down after you use it. Make sure you're not out with anyone else in the family without wearing a mask. That's really important. It can help reduce infection even in your household. It's also really important that you stay isolated, don't go back to work, and just be patient. If you haven't got those results back in 72 hours, there'll be a number or somewhere for you to contact to see what's gone wrong. It could just be as simple as a misspelling of your name, or you've mistyped your phone number when you're registering. I know it's happened to people I know, but as soon as they make that call, we find those results. So 72 hours, if you haven't got those results back, that's the time to start asking those questions. Thank you.
Good afternoon, everyone. Thank you, Doctor, for those very straightforward, clear, concise instructions. How simple is it at the moment to do the right thing? Get tested if you've got any symptoms at all. Wear a mask. The very basic hygiene requirements that will see us out of this current problem. Overnight across the region, just over 100 infringement notices for breaching the orders, around 60 of those, 15 face mask offences. The most basic of requirements for keeping yourself, your family and the other members of the community safe at the moment. Wearing a face mask, 15 people think that's not a good idea. It beggars belief. But we are still out there with our ADF colleagues right across Western Region, right across all our districts, working hard to keep our communities safe. Broken Hill, Wilcannia obviously remains a concern for us at the moment. Burke, significant numbers of people with COVID at Burke, and of course here in Dubbo, where we're still seeing really large numbers of people coming down with COVID in the community. The ADF deployment is working really well. ADF staff are with us in Wilcannia, Burke and here in Dubbo, delivering wellbeing packages, working with police on making sure people are staying home, staying where they need to be and being safe. Our traffic operations right across the region are ramping up, particularly this week. We're still getting drink driving offences. Sadly, we're still having fatal motor vehicle crashes. People are still moving around for whatever reason. In the next few days, you will see, if you are out and about for a legitimate reason, you will see a really increased presence of traffic and highway patrol cars on our local roads here in Dubbo. Please, don't be out without a genuine reason over the next few days. You will be caught and you will be issued with an infringement notice. From the EM perspective, all our local emergency management committees are meeting regularly. Local feedback, local communities involved there, making sure that any local issues are identified and sent up to my group at the region, and then obviously I feed into the State Emergency Operations Control processes in Sydney. So a really solid structure around this, but we still need people working with us to make sure we get out the other side of this pandemic. I'm happy to answer any questions from anyone online this morning.
Thanks, Jeff. If anyone has any questions for Jeff, raise your hands. Riley has one from Central Western Daily.
Hey, so just a couple of questions actually. So the first one, I know you've touched on how important it is for people dob in, people they see doing the wrong things in terms of these health breaches. But I guess, is there a way, or kind of what steps need to be taken for people to dob in? I guess people who are openly saying on Facebook or Twitter or something like that, they aren't checking into places, or not using the QR codes, or not wearing face masks. Is there a way for people to kind of really do that?
We are getting people notifying us of those type of issues. listening to the police radio. Those jobs are going over our radio constantly, from people calling in and letting us know what's occurring, whether it be in their business, at the shopping centre, or wherever it is. So we just encourage people to keep doing that, keep letting us know when people are breaching. Obviously, we can't be everywhere at any given time, but we will certainly try to get to those jobs and take the appropriate action.
Okay, great. And the other question was based on yesterday's news that all police in New South Wales will need to get vaccinated by certain dates. I was just wondering if we had any sort of statistics, the percentage of police either in Orange or the Central West who are already vaccinated.
Look, off the top of my head, we're going pretty well in most places across the region. We've been pushing this for some time now with our officers. I'll get you the exact numbers tomorrow. We're probably a little bit behind our metro counterparts, but a lot of that's been about availability. In recent times, with the ADF clinics coming to the region, we've certainly been able to use that mechanism to get some of our officers vaccinated that hadn't been able to get the vaccine. So we're working hard on that. Obviously, by the end of this month, the 30th of September, every officer in New South Wales Police Force needs to have had their first dose of vaccine, and then that cut-off later on for the second one. So we'll keep working with our staff on that. We're seeing a lot of our police exposed to COVID-positive people, and any given day we've got officers off right across the region because of that exposure, and that's not going to go away. So that's going to be with us now, I think, well into the future. So all our officers should be vaccinated where they possibly can be.
Cool. Yeah, that's all from me. Cheers.
Thanks, Riley. Gary from the ABC.
Thanks, Matt. Hi, Jeff. You mentioned the 100 or so infringement notices, which is obviously a lot. I just wanted to know if you could give some more clarification on those. Is it usually people that are getting those infringement notices, are they people who don't know the health orders, or are they people that are just openly flouting them?
Mate, who would not know the health orders now? Really? Again, it's just, look, I'm sure there possibly are some people out there who maybe don't fully understand the health orders, but the very basic requirements of the health order, that you stay at home unless you have one of those 4 reasons for being out, that you wear a mask. Everyone knows that stuff, and if you're out and about without a reason, without a mask, at the moment you are going to get a ticket.
Just a quick follow-up to that. I think some of the confusion might have been around, whether or not, because you don't have to wear a mask when you're doing exercise, but then there's the argument that it's only strenuous exercise. So I guess, is it discretionary when it comes to enforcing whether or not someone's exercising without a mask on?
Mate, I'll tell you when confusion comes into this. It's when people start looking for excuses not to do it. That's when confusion starts. If you're outside, you need to have a mask on. If you're doing some kind of serious physical exertion, yeah, take your mask off. But fair dinkum, who would be walking around Dubbo at the moment with 27 new cases overnight of COVID without a mask on? Have a think about that. The risk that they are putting themselves at, their families at, the rest of the community at. So for goodness sake, just wear a mask.
Great, thank you.
Thanks, Gary. I think that looks like it for you, Jeff. Thank you very much.
Cheers, thank you.
Bring forward Dougal now. If anyone has any questions for Dougal, please raise your little digital hands now. Riley from the Central Western Daily.
Hey, so just something that's been mentioned obviously all week is these, additional doses that might be being brought into the region. I was just looking to see if there was any update on that, really.
Oh, look, there's always expectations and attempts to get more doses as soon as possible. Scott mentioned yesterday the Health District is constantly working at trying to get more doses where they can. Obviously, there are more doses coming into Australia. We're hoping more of that's available. But really, we have sufficient doses to be doing a fantastic job. We've already seen that through the ADF clinics, but also all of those other avenues, the GP clinics. And most GP clinics now are taking clients that aren't necessarily regular clients of that service. So I guess the message is, if you don't have a regular doctor, you can still actually phone any of the GPs in your area and ask for an appointment. And many, if not most, are actually doing that because they're aware of the difference they're making with dosing. So, you know, we've got many of those availabilities now that aren't through a pop-up clinic. Pharmacists, GPs, respiratory clinics, the AMS, they're all really capable of doing, and they are doing the bulk of the dosing, to be honest. We want people to keep looking and keep trying those avenues.
Yeah, cheers for that.
No worries.
Thanks, Riley. Gary from the ABC.
Thanks, Matt. Hi, Dougal. A question about, I guess, decisions around, you know, regions coming out of lockdown and all that. To what extent does the Premier, the Deputy Premier and those other people that are in those meetings take into account, you know, I guess information from local groups as well? Like, are they having conversations with you, with Scott McLaughlin and other people as well?
Absolutely. Look, this is a decision that will be taken by all of Cabinet, but informed by, I think, a lot of community. We've got places like the North Coast. We've got places like Wagga and the Riverina where, you know, I know of places where there hasn't been a case at all ever, and also places where there hasn't been a case for over 18 months. So, you know, we are very keen to see those places able to come out of a stay-at-home order. But we're dealing with reality here, and I've been part of the conversation about what things look like for the greater Central Western region. And, you know, I think the Deputy Premier's put it fairly clearly in probably the last week, that we just don't have the ability to look at areas where there are significant cases all the time and them coming out. So for some areas, I'm really hopeful that they can. For our area, and that is the wider district that includes Orange, Bathurst, Dubbo, Mudgee, out to the far west at Burke, I can't see that there would be a way for us to be coming out of stay-at-home orders. We're all quite linked, and there are cases popping up regularly, or regularly enough, even in some of those smaller areas where there's maybe only one or two cases. They're popping up regularly enough that there is concern there, and concern about the possibility of spread. So I think in very basic terms, hoping some areas can come out, not expecting us to.
No worries, thank you.
Thanks, Gary.
Thanks, Gary. Molly from ABC Central West.
Hi. I just wanted to ask about the point you touched on earlier about the language being used by the Chief Health Officer and the Premier referring to Dubbo as being concerning. How can you expect people to not be confused when that information and those keywords are so conflicting?
Well, I think if we were a hotspot, Molly, it would have been made fairly clear by now that we are a hotspot and a suburb of concern. I think, you know, in general terms, when people talk about, well, how do you feel about Dubbo? Well, I'm concerned. That's probably the language that's been used. I think I've clarified to a lot of people on social media in the last few days, we are officially an area that is being viewed as a concern because of the cases, but we are not officially a hotspot or being judged the same way as those 12 locations in Sydney. That is not happening at the moment, and if it was to happen, there would be far more stringent things in place than what we have at the moment.
Thank you.
Thanks, Molly. Thanks, Dougal.
Excellent.
Here's everyone, so we'll bring Dr. Jan forward.
Now, when Dr. Jan comes forward, I might just get her to explain a little bit about some of the longer time frames around some of the casual contact venues and people getting messages quite a few days after that, just to explain how some of that's happening and why that's happening, as well as taking questions.
Perfect. Thanks, Doug.
Thanks, everyone. And I know it's of concern when people see a venue pop up quite late, and that usually means that the person who's been at that venue has had some symptoms, has got tested a few days later, and then we've actually got that result back. And when we find out where that person's been, when they had their symptoms, we then have to go back to when they tell us their earliest symptom, and it could have just been a bit of a snuffle that's now generated into something that made them feel pretty crook to get tested. And that could now mean that we're 8, 10, 12 days down the track. And that's why it's so important. You know, people get tested very, very often simply because they do get the snuffles or they do get the sore throat. It's really important that each time you get it, you don't write it off. Each time you have an illness and you recover, next time you get a bit unwell, go and get tested again. The test tells us how much virus you've got in the back of your nose and the throat at the time we take that test. It can change in 24 hours, it can change in a week. So that's why the test that you have on that day is the test for that time only. So if you've had a test because you had some symptoms last week and then this week you've got symptoms or they're worse, you should get tested again.
Thanks, Jan. Did you quickly want to mention a little bit about those venues of concern?
So for some of the venues of concern, the reason why we can't put them up immediately as soon as a COVID case has been there is because we often don't know that that person who's been there is a COVID case. I haven't developed amongst my many skills during this pandemic psychic ability or telepathy, so that means that we do have to wait for that person to get tested, we have to get those results back, and then we have to interview the case, and we also at the same time when we get that result in, we see their QR check-in data. And that's when we can often reach out to people if it's a high-risk venue, or we can reach out to the venue itself. Sometimes venues don't appear on our list simply because we've talked to the manager of that venue. We're able to identify every single person who has been in that venue, and we're able to message them off the back of that identification process. That means that businesses are likely to keep cooperating with New South Wales Health because we don't want to put their details out when we don't need to. And it also means that workplaces can be confident that we're doing a thorough risk assessment because, say it's the only supermarket in a town, we've got to be really quite careful that we don't accidentally close it just by calling everyone a close contact who's been there. We do need to try and make sure that businesses can stay in business whilst protecting public health. And so that's why sometimes there is even a little bit of a delay between a case telling us that they've been to a venue and us putting that venue up, because we're going through that risk assessment process where we try and make sure that we've left sufficient staff to keep essential services operating. And the other thing that of course can happen is there actually is no public health risk. The person went there before they were infectious, and so there's no public health risk. So even though somebody says, oh, I saw so-and-so at the shop, why haven't they called that out? I know there was somebody at that place. It could be either because we've already contacted everyone, or it could be that they weren't infectious when they went to that venue.
Thanks very much, Dr. Jan. If anyone has any questions, could you raise your little digital hand? We have one from Riley at the Central Western Daily.
Hey there. So just about test and trace stuff. Obviously, I'm not, don't know the inner workings of the whole thing. I guess in the process of getting these test results, I guess, is there any priority given to those test results who are testing positive rather than negative? As in, like, as soon as someone is tested positive, does that go out straight away? And if the negative tests are going out, every hour or so in a big group, is that how it might work? Or
well, when we know that the person's at high risk of testing positive because they're a known close contact, those specimens get put onto a priority run, so we get those tests back first. But unfortunately, when I've got a bag of, say, 100 samples in it, I don't know which one of them is going to test positive first, so I just have to run that bag of 100 samples. But wherever we can, when we know that there's actually a likely positive test, that's when we highlight it all over and we try and make sure that goes onto the fast run. We've also got fast testing capacity now in different areas that we didn't have 4 weeks ago. And so we've now got extra capacity in Burke, we've got extra capacity in Walgett, we've got extra capacity in Dubbo, in Bathurst, so that we can actually run much, much faster tests to give people answers back more quickly, particularly if they're a high-risk close contact or if they're a family member. If, for example, we think somebody's had an exposure through work, we can often try and prioritise those samples from an aged care facility is another good example. We prioritise those samples where the risk is highest, but can we pull out the first positive? No. But do they get notified to us immediately? Yes, they do. And as soon as we know about them, people are now getting a text message either from the lab, and then maybe 2 or 3 hours later, the lab tells New South Wales Health. So the person often knows at the moment before we actually know about it. But as soon as they ring us and say, look, I've just got this positive test message and I work, at an aged care facility, I work here, that's when we start our process. We take it on truth that they've had that message from the lab, and that's when we start working with them nearly immediately if we can. And we're still using the resources of Sydney, we're using the resources of Newcastle, we're using the resources of Wollongong to help make sure that tests in this area are acted on as quickly as possible so that we do get those case interviews done within 24 hours, which is a huge difference to, say, what's happening in Sydney, where some people, if you're a household contact, we may not even interview you.
Yeah, that's perfect. Cheers for that.
Thanks, Riley. Molly from ABC Central West.
Hi, I just wanted to ask, should just the regular public, even if people are not symptomatic or have no reason to be concerned, in terms of those testing numbers being so low, is it worthwhile now that people consider getting more like routine screening, even if they don't have a particular reason to need to be getting tested?
So, Molly, I think the hard part is balancing those uplift in testing numbers versus people just starting to get tested on a regular basis. And in Sydney, what we see is the PCR capacity can quickly be overwhelmed if too many people just decide to get tested on spec. And so that's why we do say if you've got the milder symptoms, if you've been to a casual contact venue, if you've been to a close contact venue, that's why we're really encouraging that type of symptomatic surveillance. But you'll also have other people like me who are from out of town. I have to get tested on a regular basis because I've been back to, Sydney to see my family. But again, I got tested before I got onto that plane. I had that negative result before I got on that plane. But that just tells me that at that time I didn't have COVID. If I get symptoms in the next couple of days, I still need to go back and get tested again. And there are some people who are in higher risk industries where they're actually introducing a thing called rapid antigen testing, and that's called RAT. And that's not a PCR test, that's a screening test that can help us understand if somebody's likely to have COVID or is unlikely to have COVID. And again, it's only as good as the amount of virus you've got at the back of the nose and throat at the time. You can develop COVID over an 8-hour shift, so you can be negative at the start of a shift and positive at the end of it. But the key thing is that screening test is happening more and more regularly across our region where we have had those delays in turnaround times, so people can feel confident about having people back in the workforce, so that people can feel confident. But if you're asked by New South Wales Health to get a test, the test you have to have is a PCR test. That's the gold standard.
Cool. Thanks, Molly. Thanks, Dr. Jan. That looks like it for everyone, so we'll wrap up there. I'll get the recording out to you as soon as possible, and if anyone has any other questions that would normally be directed to Scott, you're more than welcome to direct them to me. Thanks very much, guys.
Thanks, everyone.